The value of emotional intelligence in nursing leadership. Introduction. This emotional intelligence reflection paper will explain the importance of understanding emotions in nursing leadership. Emotions can convey a person's fear, happiness, or anger. Tyczkowski, Vandenhouten, Reilly, and Kubsch define emotional intelligence as the ability to manage and identify your emotions and those of others to handle interpersonal issues in a judicious manner. This form of intelligence makes it possible for more individuals to harness the best emotions and use them adequately to address problems. People with higher emotional intelligence, EI, will find it easier to regulate their thoughts. They will also cheer up others to produce positive results. This definition shows clearly that a person's EI can either hinder or enhance effective leadership. In a healthcare environment, registered nurses, RNs, and medical professionals should embrace the best competencies to support their clients. Effective leadership is necessary because it dictates the performance and effectiveness of different followers. RNs and nurse leaders, NLs, with increased EI levels will monitor the emotions of their followers. They will regulate their emotions and empower their clients. Such professionals will ensure the needs of different teammates are met. Individuals with high EI levels will identify the major challenges affecting their followers and solve problems using evidence-based approaches. Examples of emotional intelligence in nursing leadership. EI is associated with several components that make it easier for leaders to connect with their followers. Some of these components include motivation, empathy, social skills, self-awareness, and self-regulation. Emotional intelligence is essential because it motivates individuals to focus on the best results. Leaders with high EI levels will support their workmates and empower them to deliver positive results. The social skills possessed by such individuals will help them create positive relationships. The leaders will develop and strengthen their teams. RNs with high emotional intelligence tend to act ethically and practically. They will use their emotions to influence positive behaviors and focus on the best results. Such practices will ensure more nurses understand the needs of more patients from diverse backgrounds. The strategy will eventually ensure quality health services are available to more clients. On the other hand, individuals with poorly developed emotional intelligence will find it hard to influence positive behaviors. HLs without EI will not act ethically. They will be unable to encourage and support the needs of their followers. They will not interact with their patients positively. Consequently, the targeted patients will not receive the most desirable health support. Leaders without EI will make inadequate healthcare decisions and fail to form meaningful relationships with different caregivers. This fact explains why I've worked hard to strengthen my EI level. This approach will make it easier for me to make effective healthcare decisions as a leader. Emotional intelligence reflection. The simple emotional intelligence quiz test makes it easier for individuals to monitor their competencies when it comes to reading faces. The score shows clearly that I am skilled at reading facial expressions. For example, I was able to identify a sad and a happy face. I can also tell when someone is flirtatious or is in love. However, I realized that I could not differentiate expressions of anger and pain. That being the case, I am planning to examine and read different facial expressions. By so doing, I will boost my emotional intelligence and use the skills to achieve most of my goals as a healthcare worker. The exercise has helped me identify different facial expressions. I have understood how to read various expressions. As a leader, such expressions will make it easier for me to understand the major situations and challenges affecting my followers. Through the continued use of different facial expressions, I will be able to make the most desirable decisions whenever guiding my employees. This newly developed skill will support my leadership approach. I will understand when my followers require compassion, love, or empathy. These competencies will support my objectives and eventually make me a skilled provider of quality services to my followers. Patients expect quality medical support and care from their respective healthcare workers. That being the case, the skills obtained from the test will make it easier for me to support the needs of such patients. For example, a patient who is in anguish and pain should get the most desirable support. Conclusion. The caregiver should be able to monitor and decode the emotions depicted by the targeted patient. The skill will ensure the best support is provided to the client. Such competencies should be applied in different healthcare settings. The strategy will ensure more patients receive evidence-based and culturally competent care. In conclusion, I will read more articles to improve my emotional intelligence level. This development will support my goals as a healthcare leader. The new skill will make it easier for me to support the diverse needs of many patients.